protein doesn't spike your blood sugar, but carbs do. So it's having handy snacks, it's having nuts, things that are really easy grab and go.
And we have few babies who have been born just purely through the reflexology and some healing.
Nice good wake up.
Feeling better already.
And I cannot stress this enough. There is no long-term evidence that 16-8 or any form of long-term fasting is healthy in the long run. There's actually early evidence that it actually increases things like cardiovascular disease risk of diabetes. So fasting, 14-hour fast window maximum. So that would be 6 p.m. till 8 a.m., 7 p.m. till 9 a.m. That's relatively reasonable for most people. 12-hour minimum. Front load, make sure you're having protein with every single meal, including breakfast. This is where protein powder can be really helpful because a lot of women struggle. They're dashing to work, they're dashing around, trying to get 20 grams of protein in your breakfast can be a struggle. So really good protein powders can be really helpful there. And I think a lot of this, going back to what we were saying with COVID, it's planning, it's prep. It's so easy to get caught short and go, there's nothing in, I'm just going to have a piece of toast. Or I'm just going to grab something from Costa because it's there and it's convenient and I haven't got anything else with me. So it's having handy snacks, it's having nuts, things that are really easy grab and go. So focusing on protein and then strength training.
So if we have breakfast, what you're saying is avoid sugar.
As in sugar. Yeah, have some
as in
carbs,
sugar, right? Yeah.
Yeah,
So you
no like sugary cereals or.
So what would a breakfast look like? Because again, we're all busy people, right? So you might say, look, is that what? Eggs and beef or something? What is it?
Eggs and beef. That sounds quite nice.
That's why. Yeah.
Is that what you have? So I think in terms of quick breakfast, the three probably that I most commonly put on people's plans is Lizzie's granola, do a high protein, 17 grams of protein per portion. Throw some yogurt, some berries and some flaxseed on there. Absolutely sorted. If you've got time to cook, 2 eggs, bit of avocado, bit of salmon, toast. Again, that probably takes 4 minutes to make. Or make a smoothie. If you literally need something that you need to blast and get in the car, get a really good protein powder, throw in some spinach, a bit of avocado, some oat milk, some berries, some banana. It's the only issue I have with smoothies is that it's already, because it's drinkable, there's a lot of that digestive process and that hunger hormones don't actually kick in as well. But if you are literally needing to get in the car because you've got to drive for an hour, that is probably your best shout. And I've done that with a lot of clients who are very busy, where they're literally like, I don't have time. We go for the smoothie option for breakfast.
When would you use reflexology? What's its purpose?
Anything. I have so many successful stories before I learned acupuncture with infertility, with fertility journeys, and we have a few babies who have been born just purely through the reflexology and some healing. Help with sleeping, anxiety, calming, certain aches, pains, because the full body is on your feet, nerve endings and the acupuncture points, meridians, your hands, your feet, your ears. So it's not only the feet. Some people don't even know, but you can perform reflexology on the hands, so on the ears. Years ago, I had a patient, client, become a friend after severe accident, and we couldn't perform reflexology on his feet. And in that purpose, the treatment was used to make the client as more comfortable and less in pain, because he couldn't tolerate anything else. It's fantastic for the cancer patients or even the cancer patients' families, because it's calming and it's so nice and balancing. So on that injured guy, I was performing reflexology on his hands and ears, if it was possible, because obviously you need to be careful.
I think
how much they tolerate.
Is it here between the forefinger and the
large
thumb?
intestine 4. That's
yeah. So is that headache? Is that sort of headaches out?
It's a good emotional balance, yin and yang, and it will work on the head. It's a cardinal point for the face, as well, and head, face.
Okay.
Face. I always use that with any facial treatment.
For someone who may have a problem with their lower back, may have a problem with their neck or their knee, let's say, because those are the things that are the warning signs that if there's something going on.
Yeah.
Is that is that the first step where someone may seek you out, and then what you'll do is say, actually, we need to take a look at you as a whole then, because there's something else that is causing
Yeah, well,
this problem.
sometimes, because if I do like a quick consultation, just all the precautions, even the general practitioner would do that. Then I either suggest if they want something deeper, because obviously you can't pressure this on everyone. The people can feel overwhelmed, but sometimes after few sessions, the person will wanna learn more about themselves and change the few things. Because I will say, I can guide you on this if you want in the future.
Reflexology cannot diagnose at all, but particular areas, like there was a lot of yellowness over the lung area, which for me is showing kind of toxins, congestion, something like that.
Mm-hmm.
And I knew that you weren't congested, so I'm pretty much sure it was.
So it's hoovering up a raspberry vape.
I'm sure it was the vapes.
Well, that's it. Danger now. He's got to have his socks on, gloves.
Yeah, so now it's not, come in, let me smell your breath, let me do whatever, it's get your feet, let me see your feet.
So a quick look, that's it. So I think the one thing where I was sort of keen to encourage is that we've done a lot of fitness. We've had lots of people with gyms here and those things. And I was wondering whether or not reflexology was something you could incorporate into your routine anyway, even before you had an ailment. Would you say?
I think so. When I'm really trying to build up my social media at the minute, particularly Instagram, which just seems to be where everyone is heading. And I post a lot of self-care, self-help, just like even like quick 3-second things that people can do in the morning or at night with the sleep. And that's really what I'm trying to push at the minute, because it's not necessarily about coming in for a treatment. It's about kind of being proactive, and if there's something that you can do yourself at home, like in your morning routine. I posted one the other day on if you're kind of a bit like me, you come to the winter and you just don't want to get out of bed. It takes you a while to come round. Just a quick hand reflexology that people can do in the morning. And people seem to love that, because I know everyone's into kind of journaling as well and grounding and things that. So it's nice to be able to throw these things in for people to consider as well.
Do you want to give us an example?
Yeah. Why should we do it together?
Why not? Go on, practical. Hey, I like practicals. Let's do it.
So both hands you would work, obviously, one at a time.
So you do you do your left hand.
Yeah.
Okay.
Do either hand first is fine. So you've got, if you kind of do your fist like this and put your finger in, put your thumb in, and if you press quite firmly, that can feel quite tender as well if you're a little bit stressed. But this is
that's pretty chilled then.
This is your solar plexus.
Okay.
So a good one in the morning is to press in there as you're breathing in, and then relax it as you're breathing out.
Okay, that's
cool. I would do 3 of those.
Yeah.
And then a nice one is over your lung and your chest area. So that's kind of, again, just while you're doing your nice breathing in the morning.
I'm crackling there.
Yeah, you can find quite a lot of... Yeah, so that's a good one for you to do.
There.
Yeah. So this is, like I said, your chest and your lungs, and then you've got your lymphatics as well. We'll see your feet later, I'll check.
I haven't had a cigar for a while either.
And then
there's some that's
good for you to wear. Then both hands as well.
Okay.
And then your tops of your fingers is your head, but sometimes my thumb can be really crunchy. That's another one. So this is your head.
Your neck. Neck there.
Head, your neck's kind of round here.
Yeah.
That's usually quite crunchy on people too.
Yeah.
And then just going into your brain there. Nice, good.
There you go.
Nice, good wake up.
Here it is. Feeling better already.